Hey everyone, today we're talking about risk factors for breast cancer. And when we look at risk factors, we look at things you can change and things that you cannot. So under the category of things that you cannot change would be things like your age, being a woman, your race, being taller, having dense breast tissue, prior history of breast cancer in you or in your family, things like BRCA mutations, which are genetic mutations that tend to run in families. Women that have a longer time for menstruation in their entire life. So if you start your menstrual cycles early, or if you attain menopause later, that puts you at increased risk. Any kind of radiation to your chest. And women in the 1940s to 1970s that took a drug called DES, diethylstilbestrol, that was used to prevent miscarriages, they are at increased risk for breast cancer. Under the category of things that you can change would be things like avoiding alcohol, regular exercise, 30 minutes to an hour, 5 times a week will decrease your risk for breast cancer. Your weight plays a crucial role. Obese and overweight women are at increased risk for breast cancer. Women that are unable to or choose not to have children, and women that are unable to or choose not to breastfeed are also at increased risk for breast cancer. And make sure you talk to your OBGYN or your primary care provider before you go on certain types of birth control or even treatment for menopause, hormonal therapy, because they can all increase your risk for breast cancer. Even certain types of breast implants can. So I hope this was useful to you, and we will continue talking about screening guidelines and what you can do to prevent your risk for breast cancer.